Hello, everyone, and welcome back to Functional Wellness with Dr. Allison. And before we dive into today's topic, I'm going to be totally honest with you. Last week, I was taken out by some viral combination, and what hit me hardest wasn't the typical cold symptoms, it's what happened to my brain. And I've experienced this before, and you're probably familiar with it too. That deep, debilitating brain fog where you literally cannot read or focus on anything. I had to save up every ounce of brain function just to see my patients for the day, and then I would completely collapse afterwards. I had to move my book club back a week because I couldn't even read just a few pages. And true to form with viral infections with me, insomnia kicked in. I found myself doom scrolling, just waiting for my brain to come back online. And knowing that I had to see patients in just a few hours, all of my normal work was off the table. And this experience reminded me how devastating post viral neurological symptoms can be, not just for long haulers or COVID, but any type of reactivation from Epstein Barr and anything that decides to set up camp in your nervous system. So, today we're going to talk about what the current research is showing for not only pharmaceutical support, but herbal and nutritional foundations, diet and food choices, nootropics for your brain health. We're going to touch on nicotine a little bit again, and most importantly, the brain exercises you need to actually see the difference in your brain health. So, you should not wait to get started with these protocols and dive in now. So, if you've been struggling with brain or nervous system or even nerve issues after a viral infection, whether it's COVID, the flu, mono, any other virus, and now you're dealing with new symptoms like migraines, head pressure, chronic low grade fevers, or just feeling feverish without an actual fever, new light sensitivity, brain fog so thick you can't even form sentences, or maybe you can't even stay awake during the day at work, no matter how much coffee you drink, what you're eating. Maybe you're dealing with insomnia that leaves you wired and exhausted at the same time, or the opposite, where you're just sleeping 10 hours per day and still waking up exhausted. You might find that your joints and your body hurt in ways that they've never did before. Maybe your heart rate is changing, you're feeling dizzy when you stand up. You might have been diagnosed with POTS that's new, or even developed MCAS, that histamine issues alongside this. New food sensitivities, hives, histamine reactions you've never had before. These are all potentially side effects of viruses that tend to take root in our nervous system. So let's talk about what's actually happening in your brain and nervous system. The research on long COVID neurological symptoms does give us good insight into post viral brain dysfunction in general. They're very real symptoms. They're persistent, meaning they're hard to get rid of, they're happening daily, and they most likely stem from a combination of several factors. First, there's the immune system dysregulation, the changes in your T cell and your B cells. This chronic inflammation is what underlies these symptoms like the brain fog and the crushing fatigue. Your immune system is stuck in overdrive, so it's constantly sending inflammatory signals to your brain and also within your brain, creating even more inflammation. Second, many patients show autonomic nervous system dysfunction, which is changes in the regulation of your heart rate, your blood pressure, and this is why so many people develop POTS like symptoms or feel that their body can't regulate itself properly anymore, including digestive issues like IBS. Third, these studies have linked higher levels of brain inflammation with elevated stress hormones and cognitive symptoms. Your brain is literally inflamed, and that inflammation interferes with everything from memory to processing speed to your ability to even regulate emotions. So, here's what you need to understand. These symptoms can persist or last for months or even years in a significant number of people. So, this isn't something that just goes away on its own for everyone. And overall, post viral brain issues are multifactorial. There isn't just one single cause or one single treatment or root cause that works for everybody. And if you've had these underlying issues before you got sick, you might not have even known that they were there. But the immune system overload activated everything from genetics to immune dysregulation. So it might not be new, but it's new to you. So let's walk through what's currently being studied and used clinically, because I want you to understand the landscape of treatment options. And obviously, there's no universally accepted, quote, cure yet, which isn't what we're looking for. We're looking to see how the body's going to respond. So, these long COVID drug trials are testing medications to specifically look at cognitive and cardiovascular symptoms. So, we're using anti inflammatory and immune modulators like no dose naltrexone. Those are showing promise in reducing brain fog and fatigue. And that works by changing the inflammation and the neurotransmission pathways. So, it is working directly on the brain. And interestingly, metformin as well as GLPs given early on have been associated with reduced likelihood of later brain symptoms, probably due to its anti inflammatory effects. And there's increasing interest in neuromodulation techniques like targeted brain stimulation, brain spotting, and support there as well, even though they're still experimental. We're seeing that addressing underlying deficits, especially hormone imbalances, sleep disorders, and thyroid dysfunction is a big one, are going to significantly alleviate these brain symptoms. And this is why we use a functional medicine approach of looking at the whole person and why that's so critical, because it's never just one thing. So let's talk about nutritional strategies for the brain. And I want to be very clear up front, no nutrient or supplement alone is going to be a magic cure, but nutritional approaches have solid background and supporting evidence. And really, we're focused on building a foundation of support for the brain and the immune system. So that way, you also recover from future infections as well, and you don't go down this line every time you get sick. So let's start with the basics, which we always overlook because we want something different that's unique and new, but really we need to stick with the basics. Like vitamin D is crucial for brain health and immune function, obviously, but it's something that we need to take consistently. We need B vitamins for energy metabolism as well as our neurotransmitters like serotonin and melatonin. We want to use a lot of vitamin C that comes from whole foods or make sure that it has rose hips in it because of its antioxidant and anti inflammatory support. We have magnesium, zinc, and selenium because all of those can worsen fatigue, headaches, and cognitive symptoms. For antioxidants and neuroprotective nutrients, N-acetylcysteine or NAC or NAD and the precursor form of NMN have antioxidant and neuroprotective mechanisms, and studies show some cognitive benefit there too. We want to use things that support mitochondrial energy production, like coenzyme Q10, acetyl L-carnitine, and then we need lots of good fatty acids like omegas, EPA and DHA, as well as PEA, which is also very protective for the brain and reducing inflammation directly in the brain. Now, the brain needs its own specific support. So think about it. Your brain requires massive amounts of energy, specific fats for membrane integrity, targeted mitochondrial support specifically for the brain. So this is why we focus on things like omegas, phosphatidylcholine, CoQ10, especially for brain recovery. So when we talk about nootropics and herbals, we can talk about things like lion's mane, mushroom, other nootropics, and this is where personalization becomes really crucial. I found that things like lion's mane and sometimes even GABA or anything that's a quote miracle brain supplement, there's so many out there from mushrooms to nutrients. It can be really amazing. It supports nerve growth factors and nerve production. It can help with focus and memory. It can be neuroprotective as well. But if you have any underlying ADHD or blood brain barrier changes, lion's mane or GABA can sometimes make you feel worse. You might feel more scattered, more anxious. You may have more brain fog than clarity, which is the opposite of what we're looking for. And the same goes for nootropics as well. So, what works beautifully for one person might be completely wrong for another based off of your personal neurotransmitter balance, your genetic makeup, your methylation, and your specific type of brain dysfunction and what's causing it. So, my recommendation is if you want to try lion's mane or mushrooms or nootropics, start with very small doses, like a fraction of the recommended serving size. You want to see how your brain responds over several days. So that way, if you're feeling worse, more scattered, more anxious, even angry, irritable, or sleepy, that way you know that supplement isn't right for you. And of course, if you feel better and more focused and more present, you can slowly increase to find your optimal dose. So, this trial and error approach feels frustrating and takes a long time, but it's better than jumping in with full doses and then feeling terrible for weeks, trying to figure out what's going wrong when it was probably that supplement. So, let me share some of my favorite targeted brain health supplements that I've seen work really well for post viral cognitive issues. My go-to has been saffron spray, and that's been a game changer for everyone in my family as well as my patients. It's great for mood, memory, cognitive function, and the spray form allows for easy absorption and then dosing flexibility. So I love it for people who are dealing with both cognitive symptoms and mood changes after viral infections and any of that ADHD scatteredness. For dopamine, I really like to focus on support for production and function. So this includes things like L-tyrosine, cofactors like iron, vitamin B6, methylated folate, things that your body actually needs to make dopamine. Because many of us who are dealing with this brain fog are dealing with the dopamine depletion, which gives us lack of motivation, inability to feel pleasure or joy, difficulty initiating tasks, and just feeling flat emotionally. My other go-to is phosphatidylserine for supporting brain cell health, as well as reducing cortisol, especially in patients who are dealing with cognitive issues and stress. Acetyl-L-carnitine, which I mentioned earlier, can be particularly helpful for nerve health and supporting mitochondrial function in brain cells. So you really need to get that energy up in your brain as well. So I want you to start really slow and really low with all of these doses, paying attention to how your brain responds because your brain will tell you what it needs if you listen carefully. Now, I want to address something that will probably surprise you or you've heard of before, and it's nicotine. And I'm not suggesting that you start smoking cigarettes or cigars or using vapes or anything like that. But the emerging research around clean nicotine, nicotine patches, are key for long hauler recovery. So, nicotine can be neuroprotective and a nootropic to help reduce neuroinflammation. A lot of long COVID clinics are actually using low dose nicotine patches as part of their treatment protocols, especially with severe cognitive symptoms and brain fog. So, what we think is happening is that the nicotine regulates the neurotransmitter or the cholinergic pathways in the brain that are disrupted after viral infections. It can potentially improve attention, processing speed, and reduced cognitive issues like focus and memory. So, if this is something that you're interested in trying and exploring, make sure that you're working with medical supervision, primary care, someone like me. We're talking low dose patches using the 7 milligrams, carefully monitored, and definitely short term. This is not something that you need to use every day for the rest of your life. And is also obviously not appropriate for everyone, especially if you do have cardiovascular heart issues, if you're struggling with addiction, or if you're pregnant or breastfeeding. So make sure that it's something that's right for you. But I mention it because the research is really interesting. It's being used clinically, and I do recommend the patches for nervous system support and viral support as well. I have a whole podcast and YouTube video that goes deeper into the science in this, but I'll tag that in the description for you so you can take a look and learn a little bit more. So, the big thing we also want to look at is metabolic support, and ketogenic approaches or things like supplementation with medium chain triglycerides are key. So, when our brain's glucose use is impaired, especially after a viral infection, giving it alternative fuel sources through ketones will help. This doesn't necessarily mean you have to go full keto diet, but you can use MCT oil, and that will help your brain feel clearer as well. Now, I do recommend the keto diet because it's going to give you some metabolic flexibility as well. And you can get a blood ketone monitor. So you know what state your body is in that day. And then you can dial in your diet around that, whether you do need to be more keto or you can be a little bit more flexible. We want to use anti-inflammatory diet patterns like Mediterranean style diet, anything that's going to reduce inflammation. And I know this isn't sexy, it's not exciting, and talking about eating vegetables and fats and proteins and cutting out processed food, boring, but this is where our foundation lies. This is what affects our brain. And we can't ignore the gut brain axis because it's so key in the nervous system. And we know that altered gut bacteria after COVID has been showing brain changes. So, taking prebiotics, probiotic, postbiotics, and macrophages are going to be really key in making sure that you're avoiding any histamine producing strains as well if you're having any histamine issues alongside of this. Now, here's where I get really excited because this is where I've seen the biggest clinical changes in my patients. It's functional neurology brain exercises. Over the years, so many programs have come out promising to rewire your entire nervous system. And honestly, they work, but they're so pricey. And honestly, they're thousands of dollars. They're long and complicated. They're just giving you crappy therapy alongside of it that's not helpful. So I developed a techniques around post-concussion physical therapy. So let me give you an example. My phase one exercise, the one I start almost every patient with, is this. You hold your hand out at arm's length with your thumb up, keeping your eyes focused on your thumb. You gently rotate your head side to side while maintaining eye contact with your thumb. It's simple, that's it. But here's what's happening. This exercise supports your parietal and cerebellar brain lobes, which control eye coordination, focus, and balance. So these are often the exact areas that get disrupted after viral infections, which is why you're experiencing the brain fog, the dizziness, and the difficulty focusing. So functional neurology teaches us something. The test is the treatment. So that means if an exercise or a test feels difficult, confusing, or fatiguing, that area of the brain needs more attention. So the more challenging an exercise feels, the more your brain will benefit from it. So essentially, if you suck at math, you need to do more math. If your handwriting is sloppy, you need to slow down and practice. If you have trouble with balance and coordination, you need to do more balancing exercises like yoga or Pilates or just standing on one foot in the kitchen. And I see this play out clinically all the time. So some patients will only be able to start with doing one or two rotations before their brain fatigue hits hard. They have to stop, rest, come back to it the next day or even a few days later. But then they build up to 10 rotations and then 20, and eventually they can do these exercises with ease. They're building their capacity. Other symptoms improve too. The brain fog, the dizziness decreases, and their ability to focus comes back. So, as we complete the phases of these exercises on your own time, everyone's consistently reporting improvement. Is usually the most impactful thing someone can do for their recovery. And what I love about this approach is you're not just taking something or doing something to your body, you're actively retraining your brain. You're creating new neural pathways, strengthening areas that the viral infection actually weakened. It is so key. So, beyond supplements and brain exercises, several lifestyle interventions can make a significant difference. Improved sleep hygiene is crucial. And I know it sucks when you have insomnia to be like, well, just sleep more. And it's so hard. But focus on consistent sleep and wake times, wearing migraine glasses or those blue light blocking glasses during the day, making sure you're sleeping somewhere dark and cool and consistent, and then get those sleep studies done. Take care of yourself, wear your CPAP. We need to do physical activity that's graded so you're avoiding any post exertional malaise or wearing yourself down or breaking that balance of fatigue along with your brain. You need to find your own energy envelope and work within it, or your spoons, or understand what your body needs so you don't trigger any crashes. It's so key. We also need to do our stress reduction, which I know you know, but that's going to reduce the severity. And it might sound dismissive, like just relax, you'll feel better. Tell yourself you're not sick and you won't be sick, which we know that doesn't work. But anything that calms your nervous system down is going to reduce inflammation in your brain and improve its function. So it's not about the symptoms being in your head or being caused by stress. It's about using these tools to reduce the pressure on your nervous system that's already struggling. You might ask your doc about speech language or cognitive therapy because that can be incredibly valuable, especially if you're dealing with deficits in memory, processing speed, executive function. These therapists can give you specific strategies for you and exercises for you to help you rebuild those skills. So before we wrap up, I want to give you some important info that we always have to talk about. These supplements and off-label therapies, of course, are not FDA approved specifically for post-viral issues and syndromes. Things can interact with your medications or your medical conditions, so make sure that you're looking up any contraindications before you start taking a bunch of things, especially if there's a lot of ingredients in one supplement. And you're going to see a lot of things on social media, stories about vitamins or oxygen chambers or infusions or supplements. And all of these stories are helpful, they're compelling, and people are seeing these huge differences. They're genuinely helping people. But they're not substitutes for medical evaluation and evidence-based care and working with someone, whether it's your primary care, a specialist, a functional medicine doc like me, who knows your unique situation, your immune system, what you're triggered by. And this is why I'm such a strong advocate for working with a practitioner who understands these post-viral conditions and create a personalized protocol for you based off of your symptoms and your history and your immune system and just not making you feel worse by throwing everything at you. So let's recap real quick. First, post-viral neuro symptoms are real. They can last for months to even years, and they work directly on immune dysregulation, inflammation, and metabolic changes as its core drivers. Second, no single treatment works for everyone. Many clinicians, myself included, work with a multimodal approach. So we have lifestyle, therapeutic interventions, we have nutrition, we have brain rehab, cell rehab, metabolic rehab, everything all together because we need a comprehensive approach that works so much better than just throwing a supplement or one medication at a problem, or worse, just ignoring it. And third, targeted support is most useful when rooted in what we actually know is going on. So, getting your blood testing for vitamin D, B12, magnesium, your iron panels, your full thyroid panels will help you understand what's going on with your body, not just guessing and hoping that you're doing the right thing. Fourth, the neurology exercises that I mentioned are game changers, and there's something that you can start with today while you're working on other aspects of your recovery. So start looking into how can you support your brain with exercises. And as we talk about these antiviral strategies, so much is still being studied and integrated into more standard care as evidence grows. So it's a rapidly evolving field, and there's real hope for even more treatments in the near future. And I'm really excited about that. So if you're struggling with post-brain viral issues, nervous system complaints, heart complaints, I want you to know that recovery is possible. It might not be quick, it might not be linear and easy, but there's a lot of evidence-based interventions that can help you reclaim your brain function, your life, and your work again. So, in my practice, I work with patients dealing with these exact issues, creating comprehensive, personalized protocols that address the immune dysfunction, the inflammation, the nervous system dysregulation, and the metabolic changes that are keeping you stuck. So, if you want support on your journey, visit littleblackbagmedicine.com to learn about how we can work together. And until next week, be gentle with yourself, trust your body's ability to heal, and remember medicine for the body, heart, and soul.